Imagine a giant puzzle with many pieces that don't always fit perfectly. That's the American healthcare system, a complex mix of doctors, hospitals, insurance companies, and government programs trying to keep 330 million people healthy. Unlike many countries with one simple plan, the US system is a unique web of private and public parts. It has strengths, like cutting edge technology, but also challenges, like high costs. Let's explore how it works, who pays for it, and what makes it special, with some surprising facts along the way. In the United States, healthcare is not free for most people. When you visit a doctor, get medicine, or stay in a hospital, someone has to pay. Usually, this is you, your insurance company, or the government. The system relies heavily on private companies, which makes it different from places like Canada or the UK, where the government runs most healthcare. In the US, about 180 million people get health insurance through their jobs, 60 million use government programs, and millions pay for insurance themselves. But some people, about 8% of Americans in 2023, have no insurance and must pay everything out of pocket. Let's start with health insurance, the heart of the system. Insurance is like a contract. You pay a monthly fee, called a premium, and the insurance company helps cover costs when you're sick. For example, if you break your arm, the hospital bill might be $5,000, but insurance could pay most of it, leaving you with a smaller share, called a copay or deductible. Many Americans get insurance through their employer, who pays part of the premium. A typical family might pay $500 a month for insurance, but costs vary. If you don't have a job or your job doesn't offer insurance, you can buy a plan through the Affordable Care Act marketplace, also called Obamacare. The ACA, passed in 2010, helps people find affordable insurance and protects those with pre-existing conditions, like diabetes, so they can't be denied coverage. The government also plays a big role through two main programs, Medicare and Medicaid. Medicare is for people over 65 or with certain disabilities. It covers hospital visits, doctor appointments, and some medicines. Medicaid helps low income people, like families or pregnant women, and covers most costs for them. Together, these programs help about 60 million Americans. For example, an elderly person on Medicare might pay a small fee for a checkup, while a low income child on Medicaid gets free vaccines. The government spends over $1 trillion a year on these programs, funded by taxes. Hospitals and doctors are another key part. The US has some of the world's best hospitals, like the Mayo Clinic or Johns Hopkins, with advanced tools for cancer treatment or heart surgery. Doctors are highly trained, but seeing one can be expensive. A 15-minute visit to a family doctor might cost $150 without insurance. Specialists, like heart doctors, charge more. Emergency rooms are open 24/7 for serious problems, like accidents, but a single visit can cost thousands. By law, emergency rooms must treat everyone, even if they can't pay, which is why some uninsured people use them for routine care, adding to hospital costs. Pharmacies are also important. Americans spend a lot on prescription drugs, about $1,500 per person each year. Some medicines, like insulin for diabetes, are very expensive, costing hundreds of dollars a month. Insurance often covers part of the cost, but not always. A surprising fact: the US pays more for drugs than any other country because drug companies set high prices and the government doesn't negotiate prices like other nations do. However, in 2022, a new law allowed Medicare to start bargaining for lower drug prices, which could save money. How does it all work together? Imagine you catch a bad flu. You visit a doctor who charges $200. Your insurance pays $150 and you pay a $50 copay. The doctor prescribes medicine, which costs $100 at the pharmacy, but insurance covers $80, so you pay $20. If you need a hospital stay, the bill might be $10,000, but insurance negotiates it down and pays most. Without insurance, you'd owe the full amount, which can lead to big debts. This is why many Americans worry about medical bills. The system has strengths. The US leads in medical research, developing new treatments for diseases like cancer. It has fast access to specialists and high-tech tools like MRI machines. If you have good insurance, you can see a doctor quickly and get top care. The system also offers choice. You can pick your doctor or hospital, unlike some countries where the government assigns them. But there are big challenges. The US spends more on healthcare, about $4 trillion a year, or $12,000 per person, than any other country, yet many people struggle to afford care. High costs lead to medical debt. About 40% of Americans owe money for healthcare. Uninsured people often skip doctor visits to save money, which can make small problems worse. Another issue is inequality. Wealthy people with good insurance get better care than low income or uninsured people. Rural areas also have fewer hospitals, so some Americans drive hours for treatment. Interesting facts highlight the system's quirks. Did you know the U.S. has drive-through clinics where you can get a flu shot without leaving your car? Or that some hospitals offer robot surgery, where a machine controlled by a doctor does precise operations? Another fact, medical bills are the top cause of bankruptcy in the US, with over 500,000 families affected yearly. On the fun side, TV shows like Grey's Anatomy are inspired by real US hospitals, though they add extra drama. The ACA made a big difference. Before 2010, millions more were uninsured, and insurance companies could refuse sick people. Now, about 20 million more Americans have coverage. But the ACA isn't perfect. Some plans have high deductibles, meaning you pay a lot before insurance kicks in. Political debates about healthcare are common, with some wanting a single payer system, like Canada's, where the government pays for everyone. Others prefer the private system for its choice and innovation. Daily life with the system varies. If you have a job with insurance, you might visit the doctor yearly for a checkup, pay a small copay, and feel secure. If you're uninsured, you might avoid care or use free clinics, which are run by charities but often crowded. For emergencies, 911 ambulances take you to the hospital, but the ride can cost $1,000 or more. Many Americans use apps to book appointments or talk to doctors online, a trend that grew during the COVID-19 pandemic. Looking ahead, the system is changing. Technology, like wearable devices that track your heart rate, helps people stay healthy. New laws aim to lower drug prices and expand coverage, but challenges like rising costs and unequal access remain. An odd fact, some Americans travel to Mexico or Canada for cheaper medicine or surgery, a practice called medical tourism. The American healthcare system is like a busy city, full of energy, innovation, and some chaos. It saves lives with world-class care, but can be hard to navigate. It's a mix of private freedom and public help, with gaps that leave some behind. Understanding it is like learning a new language, but it shows how a country balances choice, cost, and care for its people.